Good morning, good afternoon, or good evening, depending on your time zone. We had some doctors in our private group. One of my good friends shared some statistics on healthcare costs, and I just want to share that with you today. Anthem revenue in 2019 earned 104 billion. You heard that with a B. Aetna, 69.6 billion. United, 242 billion. And I do know that last year, United Healthcare for that first quarter made something under 100 billion for the one quarter, and there are 4 quarters in the year. So, it really had me thinking. 73% of administrative costs for the healthcare dollar is spent on administration. We won't even touch the CEO salaries, but let's talk about what the doctors get is less than 8% of the healthcare dollar. So let me just break that down for you. So you have $1 million in revenue, okay? This is your house and you have $1 million. The What you have to pay out in administrative costs is 730,000. So that's three-quarter of your $1 million gone right there to admin. This is not clinical. It is not going to the doctors. It's not going towards approval for the tests that you need as patient. Okay. Of that 800, oh sorry, of that million, doctors get $80,000 of that million. Okay. Now, I don't know about you, but if that were my budget and I'm paying for something that's a right and not a privilege, it just kind of seems quite unbalanced to me. So, number one, patients, when you don't get your procedures and there's delay in your imaging and your testing, remind yourself that 73% of the money that you're paying in to make health the insurance company X make a million, or in the case billions, 73% goes towards that administration that categorically denies. It keeps doctors and patients begging for coverage, and they don't really care because it's a business. As physicians, we spent our time and we spent our training to take care of you. So, number two, when you have independent physicians such as myself, I am not under the umbrella of a medical corporation or a big healthcare system. So I am the equivalent of a mom and pop shop, as our hundreds of thousands of doctors who are kind of looking at this independent and getting out of corporate medicine. We're mom and pop shops. And if we're getting 80,000 to the million, and we're the ones that are advocating for your health, and we're the ones that are on the phone trying to get you that MRI or that ultrasound or that procedure that you need or that chemotherapy, that is our thank you. So don't think that your copays are going directly to us. They're not, in as much as it's the $80,000. Okay. So if number three, last but not least, if you think that healthcare is a right and not a privilege, I do encourage you as a consumer to please get involved. We're not talking about this to who it really matters. As physicians, we're talking about it to ourselves because we really don't want to burden you with all of this, right? But here's the deal. You got to know. So when you see a doctor in their mom and pop practice, don't think that they're making money hand over fist. Yeah, compared to if you're working at McDonald's, then yeah, it may seem that way. But when you're making your copays and you're paying your premiums, those premiums are not coming to us. They're going to healthcare costs for administration and other stuff. And 80,000 per million is coming to us in a slow trickle movement. So get involved. If it doesn't affect you, it's going to affect you. If you believe that you have the right to healthcare, because your health is important, we can prevent a lot of stuff. But if your health is important, get involved in the conversations, please. All right. Talk to you later. Bye-bye.